Doctors overdid it. What is your most oh my god what is that moment while treating a patient? A famous Australian, he is in the entertainment industry, who was a trainee doctor, tells a great story of a guy who came into the OR with something up his rectum. They took x-rays and had to take it out. Turns out the patient had a hammer up his rectum. A doctor asked if he could keep it to put in his museum of things taken out of people's asses. The patient said no, the doctor could not keep it. The patient's reason, it was part of a set. Not a doctor but a nurse. Was working in emergency for first 5 years of my career. Old guy about 80 presents. Foreign body in his butt. Turns out to be a war vet. And had a live shell about the size of a slim Coke can up his ass, probably about 9 inches long. He was very stoic. However, we had to call Australia's version of the bomb squad to assist in the removal. Exciting days. Poor lonely old guy. TL. DR. Geezer so artillery much insertion. As a medical student in a urology office, we had a young healthy male come in with problems urinating. He said he had hesitancy and a decreased stream. Pretty odd for a young male. So the doctor went through all the standard questions and it was a benign physical exam. Did a prostate exam and nothing was out of the ordinary there either, so after a couple visits a cystoscopy was done. A little black tube with a camera on the end is shoved up your pee hole to look at your bladder. Well, this guy had strictures all over the place. Extremely odd. So more questions like, have you ever had a catheter? Nonchalantly, oh yeah, hundreds of times. For what? Well, when my partner and I host parties I take a catheter and drain my bladder. We both thought that was strange and thought maybe he doesn't want to miss any of the party by having to pee. We were clueless. So then he states, and then I fill my bladder up with red or white wine. Okay, it doesn't work like that. Butt chugging sure, but not the bladder. So here comes the kicker. This guy would go around and pee in people's mouths to give them a drink of wine. It was a big gay orgy, come to find out. I just recently caught up with an old friend who is now an OR nurse and she told me this gem. She was preparing a morbidly obese woman for surgery, scrubbing her down and cleaning the areas up underneath fat rolls that haven't seen the light of day in God knows how many years. When she picked up one particularly hefty roll around the side of this lady, near the lower back, she stopped suddenly. Is that a bone? She mustered her courage and continued to investigate. A moment later she uncovered the skeleton of a small kitten. The bones were fused with the still rotting flesh of the sad little creature. Holding back tears and vomit, she walked around to face the large woman. Mom, I don't want to alarm you, but I've just found the remains of a small cat in one of your fat rolls. Lady's response, seemingly unfazed, oh, I've been looking for him. Apparently people this huge develop rather thick calluses in their fat rolls from all the friction. This cat could have been clawing for life in there and she might not have felt a thing. Poor little guy died trying to claw his way out of heck. The cat and the fat. This is a little different, but I worked as a tech in a mental hospital. One of my jobs was to go through and catalog a patient's belongings when they're admitted. One day a woman came in for her 3rd or 4th stay. She's pretty disheveled, as per usual, and smells pretty rough, which means going through her bag will be no fun. I pull a pair of gloves on and get started. Opening the bag releases the most awful smell, like something had died in the bag. So, with my gloves on, and considering a second pair too, I dig in. I find normal stuff. Dirty shirt that has holes in it, used tampons, coins and cash that are sticky, bits of fur. Wait, I think, bits of fur? That's strange. And here at the bottom of the bag is more. I lift up some dirty pants and there it is. A dead cat, slightly rotting. Something had died in this bag. After she was kicked out of the last place she had lived, she stuffed the cat in the bag to keep it warm and safe, and apparently forgot it. While my wife was in medical school, she helped treat a patient who was having difficulty urinating. She and the doc asked all the preliminary questions, but they still weren't sure what the problem might be. So the doc orders an x-ray. She notices a tangle of dark lines in the patient's bladder. The doctor then went in to show the patient the results as she was thoroughly stumped. After the patient sees the x-ray, he freely offers up that he likes to take baby snakes and let them slither up his urethra where they ultimately die in his bladder. His reason for doing this? Well, he said it gave him a funny feeling. That's a trip to the psych ward right there. I am not a doctor but a nurse going on 18 years. Yes, I have seen some amazing things in my career. People talk about finding maggots in wounds. Well, we actually use them in our hospital to clean up wounds. Ordered from a lab in Cali, they are raised in a sterile environment and packed into a sterile specimen cup and shipped overnight. Normal application is 500-1000 maggots per wound. They are placed into the wound and secured with a mesh DRSG and left in the wound normally 2-4 days, then washed out and disposed of. They only eat dead flesh, usually air and felt, and do a tremendous job so that the PT can avoid surgery. I once had to put $20,000 on a young lady who came in with necrotizing fasciitis of her leg. Started as a cat scratch on her knee. PT ignored it over several days while it was eating her tissues. She came in unresponsive in the home and septic after keeping it from her family. When she arrived, the only thing holding her leg on was the muscle bone and dead tissue. The Points family wished to save the leg and avoid amputation. Surgeon said to do maggots. 5 hours later they were applied. She eventually lost the leg and underwent amputation. Early on in my career, we took a call for an unconscious unresponsive female. We get on scene and fire is already there. They are in full bunker gear with SCBAs. We could smell it from outside. This lady had a colostomy and developed C. diff. She rolled out of bed and the bag tore out. She laid in an ever-growing puddle of her own crap for 2 days before someone found her. The sores she had were so infected. The smell was awful. We had to drag her outside and spray her off with a water hose before transport. That ambulance was out of service for a week being deckened. Was working in a free clinic, and the residents of a halfway house came as a group to get checked out. I picked up a file, found my patient, and we went back to our little curtained off area. He seemed a little off, but so did many of our patients. High rates of drug abuse, mental illness, etc. Can't do that, so that didn't really throw me. I asked him what we could do for him today and he said, I want you to look at my head. I ask him what is wrong with his head, and he just says that it hurts and I need to look at it. I ask him to take his hat off. He says, I think you should have gloves first. That should have been my first warning. I assure him it will be fine, and he slowly takes off his hat. Underneath is a durag, so I still can't see anything, but that's when the smell started. It's a smell you can't really describe unless you've smelled it, but many of the other healthcare people here will know. It was foul, putrefying, like flesh was rotting. I can't even find the words. I ask him to take off the durag, and so he starts to peel it off. As I get hit full force with a wall of the worst smell I've ever experienced, I see his head is entirely covered with abscesses. Big ones, inches in diameter, all coalescing together to completely cover his scalp. Many were bursting open, with pus oozing out. His head was a minefield of pus. I decide that now might be a good time to grab some gloves. It turns out he also had similar abscesses in his armpits, which I looked at and confirmed, and in his groin, which I did not. Everything was oozing pus and smelling so incredibly bad. By this point the smell was permeating throughout the rest of clinic, and as close as I was to the source I don't know how I didn't throw up. Although he was in pain, he didn't seem to understand how serious it was. That level of infection anywhere is bad, but in the head has the risk of finding its way into the skull and therefore the brain. And it took a lot of persuading to convince him he needed to go to the ED for higher level treatment than we could do. This was near the beginning of my training, and I've seen a lot more gross things since then, but that's the moment that I always remember. I once made a nurse scream, "Oh my god." She got reprimanded even though I just laughed and didn't mind. I had terrible pink eye in both eyes. It literally looked like I just had bright red eyeballs. Worst I've ever seen. I was in my senior year of college, in the middle of midterms, so I had to put off my doctor's apt for like 2 extra days. During that time my one eye's mild case of pink eye spread to the other eye and went from mild to raging infection. My eyes are already slightly startling. My irises are yellowish green, almost like a cat. So combined with bright red eyeballs, I looked like a cat demon. I walked into the office and whipped off my sunglasses and the nurse screamed and did the sign of the cross. My proudest moment was once observing a surgical removal of an ovarian tumor. It was a teratoma, so when the surgeon cut it open it was full of mush and hair. Teratomas can be pretty cool. I've seen scans of teeth growing in them and all. My mother was an ICU nurse for over 10 years, so never a dull moment. On her first day she was taking a break when a woman walked into the hospital with her head wrapped in a towel. Mom said she was speaking quietly and calmly and explained that her husband had a violent outburst and threw a hatchet into her skull. Lucky for her, he hit her in her forehead, the thickest part of your skull. So she was able to wrap herself up and drive herself to the hospital. Woman was fine overall, and police arrested husband. My good friend is a physician's assistant. They had someone come in who had lost an eye and developed some sort of rash around the area. They inspected it and quickly realized it was herpes. Apparently the person had been removing their glass eye and selling out their eye socket to use it for fricking, contracting herpes in the process. Just to be clear, the eye socket is very shallow, so it would basically involve someone just rubbing the end of their dong in it. There is no brain fricking involved. Not my doctor story, a friend's. Awkward gay couple walk in, one with severely sore lower abdominal pain. Turns out the reason for the pain is a butternut shoved up his ass. Have to cut it out, but can't use a scalpel. Too many blood vessels or something. Will bleed a lot. Have to use one of those cauterizing knives. Surgery smelled like lunch. TLDR. Gay guy had butternut cooked in his butt. My friend's brother, who is a surgeon, told me lots of WTF stories, but my favorite is this one. More funny than gross. While a student doing residency at Anonymous Major Not RPH or Joondalup Hospital in Perth, Western Australia, a patient was admitted through the emergency department because he and his boyfriend had been playing a kind of adult game where they each stuck a balloon on a straw up their urethras and took turns to blow into the straw, which apparently gave them an OMG need to pee feeling and a fit of the giggles. But this time, said patient had laughed so hard the straw came out, leaving the partially inflated balloon behind. The docs tried a few things to pop the balloon but couldn't quite get at it, so they decided that a quick keyhole and camera into the bladder to puncture and remove the balloon was the only option left. The keyhole went fine and the balloon was easily deflated and removed, along with many other fragments of variously colored balloon material. My buddy's bro said there though maybe 10 or 12 balloons had popped in this patient previously, leaving fragments in his bladder. It wasn't the first time this boy had lost a balloon up his dong, but it was the first time it had been full of air when he lost it. TLDR dude lost multiple balloons up his dong playing adult games until one day one twisted off while blown up. Surgery ensued. Yeah, it's a story I heard from a guy. It might not be true. It might be partly true. It might be an Australian med student's urban legend. That doesn't make me a freaking liar, it makes me a storyteller passing on a story I heard. I think I made that clear at the start of my post, but if not, here it is again. This CI know once told me this story. Note to self, condom goes on the dong, not in the dong. I was working in an urgent care clinic in South Atlanta, GA, and had a patient come in complaining of itchiness on his chest and back. I examined him, did a scraping and diagnosed him with tinea, fungal infection. As I am discussing treatment options, he casually mentions that he has some itching in the groin area as well. After consulting with the supervising physician, it was decided that it should be examined. I gave the patient a gown and asked him to change. Upon returning to the room, I see him sitting on the exam table in only a pair of mesh underwear, the disposable kind you get after childbirth, stuffed with gauze. I inquire about his use of this particular type of undergarment and he proceeds to tell me that he, in his 50s, and 4 friends of similar age had been circumcised 7 days prior. The diaper rash, for lack of a better term, was visible on the inside of his thighs, and I informed him that we would need to examine him further. Removal of the underwear and gauze revealed a swollen glans and shaft, with stitches on the underside barely holding together, a dehisced, non-healing, split apart, incision. There was pus oozing from the unhealed incision and a yeast infection covering his entire groin. He repeatedly said he was not worried about the surgery, he just wanted to stop the itching. We started him on antifungals and antibiotics and tried to reach his surgeon. After several hours he decided to leave and promised to see his surgeon the next day. TLDR, I have never been so sure that a man was going to lose his dong. Urology resident here. On my 2nd month of intern year, Brand new to doctoring, I saw a patient in our spinal cord injury neurogenic bladder clinic who came as an add-on one afternoon about 3 months before her next scheduled appointment. I go in to see her thinking she was having some problems with drainage of her suprapubic catheter, a tube placed through the anterior abdominal wall into the bladder to drain the bladder. She starts to describe to me how she changed the dressing over the catheter earlier in the week without issue. When she changed it this morning, she noted a bloody drainage from around the catheter. I go to examine her while she is sitting in a motorized scooter. I throw on some gloves, lift up her shirt, and begin to peel the dressing back. As soon as the tape comes off the skin, a tan ball of something about the size of a donut hole falls to the ground between her legs. I looked down and saw it wiggling. A ball of maggots. I pulled the dressing fully off and saw them all retract into the skin around the tube. I had no idea WTF to do, and she's like, "That's normal, right?" I'm like, "Yeah, this happens all the time. Give me a moment." I left the room and found my attending, who is this grizzled old vet who's been doing this longer than I've been alive. I describe the maggots and the maggoty ball to him and he doesn't believe me. He follows me to examine the patient. We excuse ourselves again, and once outside the room he looks astonished and goes, "I don't know what to do with this. I've never seen this in all my years of practice." I went, "What a coincidence." Neither have I. I did some quick reading on my ASIS, came up with a plan and fixed her up. Every once in a while I'll look her up on our electronic medical record to see if they came back. I'll have you know she's maggot free, and I'm still the guy who's notable for dexterous removal of maggots. Not a doctor but a nurse. I was the tissue viability nurse for my ward, which basically means I go round checking people are not developing ulcers from being stuck in bed too long. I was doing a normal round and I come to a 19-year-old who had just had a lung procedure. This will be quick, I thought to myself. Younger people are generally lower risk to these things. I had been looking after this guy a few days post-op. We were both pretty young and got to build up a good rapport with him. So I approach him and explain how I need to check his sacral area, aka your butt, and apologize, saying it should only take a glance as I'm sure it will only take less than a minute. He laughs it off with me and says, "Actually, silly egg, there is something there. I didn't really want anyone to see, so I have not mentioned it before, but for the last year it is always painful when I go to the toilet and wipe my butt after." Alarm bells ring at this point and I go full nurse mode and decide that something was not quite right. So I put on my protective gear, gloves and stuff, draw his curtains and dive on in. I was not prepared for what was there. As I pulled his cheeks apart to inspect the skin, it literally just kept going, right down to muscle and bone. The worst part though is it was full of infection. The smell was so powerful, it literally hit me in the face. Not only was there bacterial infection but fungal too. It was like Jackson Pollock had gone up in there and created a masterpiece. I did not dare part the wound open all the way because I could not see how deep it went. I turned to the poor guy and explained he had a serious wound there and I needed to get the doctor to look at it. He was amazing about it. While I was fetching the doc, he got his friend to take a picture on his phone so he could see it. I will never forget the words he said when I came back round the curtain. "Oh my god, silly egg." My boss goes on forever. No wonder it hurt. I at this point nearly keel over laughing. Awesome kid. He made a full recovery. D. He ain't a doctor, but one evening working in prison infirmary I had an inmate brought in with a pencil stuck up his dong, bleeding copiously, and apparently it wasn't the first time he'd done this. Well, I once saw this CT scan of a psych patient who fired multiple nails from a nail gun into his head. There were at least 4 nails going right through his brain. It was pretty cool, really. Kinda. My mom worked as a nurse in surgery for many years. They had one guy show up at the OR with a loose towel around his waist. He tried to be romantic by putting a rose in his urethra for his wife. Roses are thorns. Thorns slide nicely one way and are bobbed the other way. He couldn't get it out. Everyone was laughing as they cut it open and took the rose out. When attending a urology conference, you get to hear quite a few WTF stories. Here's my favorite, where there even was a video along with the question, "Guess what we're looking at?" My guess was that what was shown was the inside of a bladder. Got that part right. And 2 small corn cobs floating around inside of it. Lighting and overall video quality of the endoscope feed wasn't all that good. 2 small corn cobs would have been weird enough as it is. Turns out we were looking at 2 slugs. Actual slugs. Apparently the PT walked into the hospital claiming that something did not feel right when peeing, and after being confronted with the contents of his bladder claimed that he took a nap in the grass the day before and the slugs must have crawled inside by themselves without him noticing. Happens all the time, right? There was other WTF stuff, but that one was my favorite because video, TLDR, apparently slugs like to crawl up your urethra. Several here. Intern year in general surgery, a young patient with cerebral palsy and mental retardation gets admitted for decreased PO intake. Long story short, we open his stomach and pull out a ridiculous amount of chewed up plastic toy balls, plastic bags and an alligator. Plastic. Second year of urology, admit a guy overnight who stuck something in his urethra and couldn't get it out. Looked like tweezers on x-ray. Put a scope in and found, yep, tweezers. Almost had to open his bladder to get it out. Few from my other residents. Necklace in the bladder. Glass thermometer in the bladder. My favorite though. In jail, this patient melted dice to make small shapes that he then implanted into his skin under his urethra for her pleasure. Gets released from jail. She doesn't like it. We surgically remove. If I feel motivated, I'll post the image to Imgur later. Oh. Also had a young man get shot in the taint with a shotgun and his urethra and anus were trashed. Poor kid. This was during residency. Had a husband bring his wife in for an ingrown nail. Every nurse avoiding that room due to the smell was my first clue. I looked at her and pondered what to do with this foot that was wrapped in a big black garbage bag. Underneath said bag were layers and layers of newspapers. Unwrapping their homemade dressing invoked the worst odor I've ever experienced. I got to the point of gagging, and I have a very strong stomach, and had to leave the room, put a surgical mask on, chew gum, and breath through my mouth. All the while thinking I'm tasting this stuff most likely. Finally got the dressing unwrapped and this great toe had wet gangrene and is auto-amputating due to the layers of rubber bands the woman had wrapped on the base of her toe. The couple lived in an RV, driving from place to place, state to state. The lady thought by wrapping the toe with rubber bands she'd prevent the ingrown nail from spreading. The odor started and she wrapped newspapers and finally garbage bags. The husband admitted that he brought her to the clinic because he couldn't stand the smell anymore. She ended up getting a transmetatarsal amputation. It was interesting for me since I got to perform it and it was my first one. Hearing an elderly lady fall in the next room and running in to get her. It's dark, and I can see she's on the ground and has lost one of her shoes, but she's not yelling. I ask if she's okay, and she says, "Yes, I'm sleeping, can't you see?" So I go pick up the shoe so it doesn't get in the way when I pick her up. Once it's in my hand, I suddenly realized what it is. It's not a shoe, it's a huge hunk of flesh from her calf. She's not in pain. Weird, but dementia patients are like that sometimes. So I put a pillow under her head, a blanket on her again, dementia. She wanted to rest, and call 911. She was fine. Ended up growing 30% of her calf back in 4 months. The feeling of a bloody, warm chunk of calf in my hand will linger on though. R.I.P. little Missy. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.